Hello, everyone. So we got to start the second part, and I will introduce the third keynote speakers, which is Dr. Anand Pratap Singh. Dr. Anand Pratap Singh is a Singh, I think, Singh. Okay. Is currently working as head of Department of Psychology and Mental Health at Gautam University, Greater Noida, India. Since July 2012, before joining the GBU, he has served as KGMU, Lucknow, Amity University, Noida, and Apollo Hospital, Delhi, in various capacity. His area of expertise has been brain fingerprinting, neurocognition, and neurofeedback therapy. Till to date, he has supervised 8 PhD and also 29 theses in the area of clinical neuropsychology. He has published more than 40 research papers and book chapters to his credit in repeated national and international journals. As well, he served as chief editor of journal IGPRT and editor of SIS journal. He has been recipient of Innovative Scientist Award in the area of brain fingerprinting in the year 2021, the India Academy of Health Psychology. The Positively Award in the area of neurofeedback therapy in the year 2019 by Brain Behavior Foundation of India. Dr. Tara Nudi Award by Indian Psychiatric Society in the year 2002, Young Scientist Award by IAAP in the year 2007, Outstanding Contribution Award IAHP in the year 2016, and Professional Excellence in Clinical Psychology Research and Training by Her Excellency SMT Samantha Mridula Sinha Chi, Governor of Goa in the year 2017. He is also fellow member of Indian Association of Clinical Psychologists, fellow member of IAAP, IAHP, and also ICP North Region. Welcome, Dr. Anand. Yes. Yes, please. Our city.
Thank you, Dr. Ella. All the esteemed audiences, a very good morning to all of you. Before I start my session, I would like to extend my sincere thanks to the organizer for giving me this opportunity to share my views today in the second European Congress of Neurology and Neuropsychiatry. The concept what I'm going to discuss, that is the brain fingerprinting technology. Actually, this technology, brain fingerprinting, has already been well discussed and researched in the area of forensic investigations and forensic sciences. Generally, the scientists and researchers, they use this technique, brain fingerprinting, in the field of investigating the suspect and differentiating from the innocents pertaining to any specific crime. The concept behind this brain fingerprinting technique is how the real experiential could be differentiated from the virtual experiences. Keeping in mind that the similar kind of phenomena could be associated with psychiatric aspect too, pertaining to the various psychiatric conditions. We tried to apply this technique, brain fingerprinting, in field of psychiatry, particularly to assess and to diagnose those conditions where we feel like that the argument of real versus virtual experience may exist. So, coming to the point, as we all know that the phenomenology of psychological problems and its manifestation has always been a point of discussion and has witnessed many paradigm shifts in its exploration and manifestation. Particularly, when we try to interpret the deviant behavior or psychological manifestation on the part of any individual, if we look into the ancient time, we generally used to take the help of supernatural approach to explain the deviant behavior on the part of any individual. We used to believe that this could be because of the possession of demons and witches on the part of any individual, and maybe because of some black magic, maybe because of the person is in possession of some evil spirit. So this was the supernatural approach what we used to take help in the ancient time to explain the deviant behavior or psychopathological manifestation on the part of any individual. Then thereafter, we moved ahead and we started arguing about the biological perspective to explain the deviant behavior on the part of any person. And we attempted to explain by taking the help of biological perspective, biological relations, and how that is instrumental in developing the psychopathological behavior on the part of any individual. And then thereafter, we again moved ahead to explain the same psychopathological behavior by taking the help of psychosocial perspective. But currently, the most prevalent model, what we discuss to explain the manifestation of deviant behavior or psychopathological manifestation, that is the biopsychosocial model. So currently, this biopsychosocial model generally helps to explain any deviant behavior or psychopathological manifestation on the part of any individual. But when we try to explain the psychopathological behavior, the most discussed anecdote what we come across, that is the functional versus biological. We try to look into the things whether the behavioral manifestation which is being manifested by the individual is having some biological correlation, is having the biological belongingness, or it is purely functional in nature. Even in case of many psychiatric conditions, this anecdote could be very, very relevant to look into whether the behavior is being manifested is carrying some biological relation or it is purely functional in nature. And just because of this, like with the same anecdote, we attempted to take the paradigmatic move in exploring the psychopathology with the help of brain fingerprinting techniques. Brain fingerprinting technique, as I discussed with you, is an established scientific technique with suggested uses in the forensic investigation with the help of P300 and P300 murmur waves in response to the words, phrases, or pictures presented from experiential context of any individual. So basically, this BFT works with respect to the P300 waves, P300 murmur waves, and that is generated when the person is exposed to some specific stimuli, be it in the form of some words or some phrases or some pictures. So it could be the pictorial stimuli, or it could be some written words, or it could be some phrases. So corresponding to these specific stimuli, the P300 and P300 murmur waves could be generated. The difference between the P300 and P300 murmur is with respect to the amplitude and the latency time. Generally, P300 is having the latency time from 250 millisecond to 500 millisecond. And when we talk about the P300 murmur, that may have the latency from 500 millisecond and above up to 800 millisecond. When any specific external stimuli is generally presented in front of the subject or the individual or patient, when the person processes that particular information and starts evaluating that particular stimuli in categorical manner, immediately the P300 and P300 murmur waves could be generated. In many of the researches, it has been observed like the P300 is having reduced amplitude and prolonged latency with respect to various neuropsychiatric conditions, with Alzheimer's disease, schizophrenia, depression, PTSD, and panic anxiety. Because of its specificity of latency, the scope of application of P300 murmur is derived to be studied in cases of psychiatric conditions such as delusion, hallucination, and dissociative amnesia. Though we have extended the application of BFT in other cases also, like in other psychiatric conditions also, but here in this presentation, I have just covered the three psychiatric conditions: the delusion, hallucination, and dissociative amnesia. P300 murmur is a wave termed as memory and encoding related multifaceted EEG response, considered to be the part of the larger response of the P300. As I discussed with you, like this is how we generally differentiate, like P300 murmur is having the latency time more than the P300, and that is from 500 millisecond till 800 millisecond. P300 is maximal in the parietal region as well as also observed predominant in frontal areas. So when we attempted to apply like this concept of brain fingerprinting in various cases of psychiatric condition, so we also tried to look into the various researches, and we reviewed some of the researches just to see whether the P300 or P300 murmur has been studied in the cases of psychiatric condition or not. And we came across like some of the studies are there. Like in case of dissociative amnesia, it has been observed that the loss of information is not having any biological relation. In other case, malingering and factitious disorder, again, the researchers have conducted these studies and they have come across that the symptoms of malingering and factitious disorders do not have any real experiential context and doesn't carry any fingerprinting in the brain pertaining to these specific experiences. In case of like forensic investigation, the studies have been conducted by Farwell and Richardson, and they have differentiated by taking these specific crime conditions where they argue that the real experiences could be differentiated from the virtual experiences. In case of somatization disorder or somatoform disorders, again, the P300 latency has been studied by the researchers. And in case of delusion and hallucination, again, many studies have been conducted by taking the help of P300, and they have studied the nature of P300 in case of delusion and hallucination. So by coming across about the various like the researches which have been conducted in the area, then we came to this rationale like the generation of P300 and P300 murmur may be applied to the specific psychiatric condition where the manifestation of symptom is explored with respect to real versus virtual experiential context. And the nature of psychopathology, which are based on the anecdote of functional versus biological argument, could be explored with the help of brain fingerprinting technique. So as I discussed with you, the same concept we applied in psychiatric conditions also to look into that whether the BFT is like applicable to differentiate with the real experiences with the virtual experiences or not. Now, what is the procedure? How like this BFT technique could be applied? So the first thing, like when we talk about the brain fingerprinting technique, so there are specific apparatus to apply this particular technique. So one computing system is there where One laptop is there, which is having the installation of the specific software pertaining to the brain fingerprinting technique. Then another screen is there, which is connected with that laptop, and that screen, that is generally that helps the subject or the patient to get the exposure of the specific stimuli, which is presented through the laptop or through the software. Then another thing, we have the headset, and the headset is containing the electrodes. So the two electrodes that is generally placed, one is towards the frontal region. So we generally cover from Nasian to Enian part on the scalp, and one electrode is placed near to the Enian part, and the other one is near to the Nasian part. So, and two other electrodes are there, which are generally placed near the ear lobes. So this is how all the four electrodes are placed on the scalp. And once this headset is like placed on the scalp of any individual, so it's a kind of wireless device and gets connected with the laptop and the software through Bluetooth mode. And the other screen, which is connected through the wire with the software and the laptop, that is generally placed in front of the patient who is going to be assessed by taking the help of brain fingerprinting technique. So this is how we generally prepare the experimental setting for conducting the brain fingerprinting technique. Now, what do we do? First, we collect the information pertaining to specific psychiatric condition. I mean to say, like, suppose if the person is having delusional disorder, hallucinatory condition, or some specific psychiatric condition. So pertaining to that particular psychopathology or psychiatric condition, we collect all the information by taking the help of clinical interview and case history taking. So once the entire information is collected on the part of the patient, then we categorize the information in the form of the probe, target, and irrelevant information. Probe generally contains those information which is particularly related with the delusional beliefs or hallucinatory behavior, or in case of dissociative amnesia, like pertaining to the loss of information what the patient claims to be forgotten. So this is specific information which is generally considered to be only known to the patient. That information is categorized under the probe category. Then the other information which may be known to the patient as well as known to the other people around, maybe the family members and friends or the other people around the patient. So that information is generally categorized under the category of target. And then the third one is that is the irrelevant information. So under the irrelevant information, any neutral stimuli or neutral information could be put together to form this category of the irrelevant information. So once after collecting the entire information regarding the clinical condition by taking the clinical interview and case history taking, we categorize the information, then the experimental setting is prepared. After preparing the experimental setting, the placement of electrode are ensured by taking the help of the headset, as I discussed with you. And then through the softwares, by taking the help of the VFT software, we start administering the stimuli, I mean to say, exposing the patient towards the specific stimuli that is categorized into the three categories, like the probe category, target category, and the irrelevant information. Once the administration of stimuli is started, the patient, as soon as the patient comes across the exposure to the stimuli of various category, the triggering of neurons and generation of ERP could be there, and that may be visible in the form of the brain waves on the screen of the computer. Once the patient starts processing those stimuli, I mean to say, the evaluating the stimuli, what is presented in the form of the probe, target, and irrelevant stimuli. So immediately, the P300 murmur may be generated. And by taking the help of statistical classification of algorithm, that information is generally analyzed whether the patient is able to recognize that information or not. If the person or the patient is able to recognize the information or recognize the experience, the P300 murmur is generated, and that somewhere shows that the information is present in the brain. I mean to say, the fingerprinting of that information is there in the brain. If the P300 murmur is not generated, I mean to say, the patient is not able to recognize the information, then the information absent could be observed on the screen. Corresponding to these, like categorization of the information, the wave patterns which are visible on the screen, this could be in different colors, like the blue color is there, which is pertaining to the probe information. So brain waves which are being generated corresponding to the probe information, that would be in blue color, and the brain waves which are being generated corresponding to the target information, that would be in red color, and the brain waves which are corresponding to the irrelevant or neutral stimuli, that would be in the green color. So once the information is recognized, I mean to say, the experience is real in nature on the part of the patient, then the two waves, like the blue wave and the red waves, the brain waves, the lines may get coincides with each other. That somewhere shows that the P300 murmur has been generated and the information has been recognized by the patient. It means the person is having the fingerprinting of that information in the brain, and these two lines may coincide with each other. Once the information is absent on the part of the patient and the patient is not able to recognize the information, the two lines may not coincide with each other. I mean to say, the blue line and the red line, which are somewhere implying corresponding to the probe information and the target information, may not be recognized by the patient and may not coincide with each other. So how do we explore the psychopathology? By taking the help of the brain fingerprinting. So as I discussed, like we took the various psychiatric conditions under consideration. The very first condition what we took, that was the case of the delusions. So the patients of delusional disorder or having the delusions, they were taken for the study, and after collecting the information pertaining to their particular delusional condition or delusional beliefs, as I discussed, the entire information was categorized into the three categories: probes, targets, and irrelevant. The BFT was applied, and after applying this BFT, it was observed like the data analysis indicated the information absent, means the patient's experiential context was beyond the reality and it was purely virtual in nature. So this is how the result is interpreted, and you can see here the two lines, like the blue as well as the red lines, which are have been generated corresponding to the probe information. Probe information means the delusional beliefs, and the target information means like the information which is very much known to the patient as well as the family members. So these are not coinciding with each other. It means the experience what is being shared by the patient in case of the delusional condition, that is not true in nature and is not having any real experiential context on the part of the patient, rather it's purely virtual in nature. Another condition what we took under the consideration, that was the hallucinatory condition. So in case of hallucinations, again, we collected the information, and after collecting the information, again, the information was categorized into probe, target, and irrelevant. And again, once the BFT was applied, the data analysis again indicated information absent. It means the patient's hallucinatory information was not from reality experiential context, but entirely virtual in nature. This is again the picture what we got after the analysis, and you can see here again like the two lines are not coinciding. I mean to say the P300 MAMA was not generated, and the information which was the part of the hallucinatory behavior provided by the patient when presented in front of the patient through the the computing system, the fingerprinting of that information was not there in the brain, and the patient could not recognize these information. However, when we took the case of dissociative amnesia, so dissociative amnesia is a condition where generally the patients claim to be forgotten the information related with the various aspects of the life, be it like the personal information, occupational information, professional information, social information, be it the information related to the various events of the life. So generally the patient claim to be forgotten all these information. So we took the case of dissociative amnesia and we followed the same process. We collected the information by case history taking and clinical interview. Further, the information were categorized into the probe, target, and irrelevant. And when the data was analyzed, it indicated that the information is present. It means the patient had the memory of information in the brain, and the loss of memory reported by the patient was not congruent with the experiential context. So now you can see here how the two lines are getting coincide with each other, the blue lines and the red lines. So the P300 MAMA was generated once the personal information pertaining to the life of the subject or the patient, what the patient used to claim to be forgotten, was presented. The information was very much recognized by the patient. It means the fingerprinting of those information was there in the brain, and the patient could very easily recognize all those information, and P300 MAMA was presented. How does this BFT contributes for the psychiatric investigations? The major benefit of the brain fingerprinting is that it brings the information on record, which is stored in the brain of the subject or the individual. So generally, like in psychiatric condition, many psychiatric conditions are there, be it malingering behavior, factitious disorder, delusion, hallucination, dissociative amnesia. Even in case of the domestic violence, that again comes under the in category of the psychiatric condition having the comorbidity of the various psychiatric condition, and generally these cases are also referred to the mental health professionals to deal with. So many psychiatric conditions are there where it is considered there could be the argument real versus experiential, real versus virtual experiential contest on the part of the patients. So this BFT may contribute to differentiate between these conditions where the patient is having the real experiential contest or it is purely virtual in nature. Many times, if you talk to the family members, psychiatry is the only condition where we come to the point about the.
Hello, everyone. So we got to start the second part, and I will introduce the third keynote speakers, which is Dr. Anand Pratap Singh. Dr. Anand Pratap Singh is Singh, is currently working as head of Department of Psychology and Mental Health at Gautam